Good morning, everybody. My name's Liam Brennan. I'm a consultant anaesthetist here at CUH, and I am a Deputy Medical Director.
Good morning, I'm Theo Goulouris. I'm a microbiology and infectious diseases consultant.
So, face masks have been introduced following government policy on the 15th of June, and this follows an increasing appreciation that hospitals are a potential hotspot for the development of outbreaks of COVID-19. So masks are available as staff come into the organisation at the start of their working day, and those entrances are at the hospital main entrance, the Rosie, the ATC, the Barclays Bank entrance, and at outpatients from early in the morning until late in the evening at supervised stations where they can pick up a mask and also perform hand hygiene. So it's important to emphasise that the wearing of face masks is only part of the strategy to decrease the transmission of COVID-19 across the hospital. The same messages that have been emphasised over the past few months around social distancing, performing hand hygiene or hand washing frequently, the importance of maintaining good environmental hygiene, making sure your surfaces are clean, and wherever possible, trying to make sure that the environment in which you are is well ventilated.
The most important thing is to try to avoid contaminating your mask. So first step is to use alcohol gel or wash your hands before you touch the clean mask. You can pick up the mask, you identify, if you're not familiar with it, the outside, which is always the blue side, and you identify the upper side, which is the one that has the wire, so you can see it's a bit of a harder part. So once you know that, you apply it on your face and place the loops around your ears. And then you have to mold the mask around your nose and your cheeks to make sure you obtain a good seal. And that's it. Sometimes, because some of these masks can be a little bit loose, you can also twist the loops once around your ear to obtain a better fit. Whilst you have the mask on, it's important to avoid touching it to prevent contamination of the mask with any potential dirt that may be in the environment. If you do touch though, because we accept that people may not be used and they may touch it accidentally, then that's fine. Just make sure you immediately wash your hands or use some alcohol gel to decontaminate your hands.
We recently, yesterday in fact, published the COVID Secure risk assessment process, and so that allows staff in some parts of the hospital to not have to wear face masks according to a risk assessment process. And the key principles of that are that in the individual area they're working, particularly in the non-clinical environments, to emphasise that, in the non-clinical environments, their line managers will risk assess the area in which they're working, and some of the principles that will be used in that risk assessment are, as we've already discussed, is there adequate opportunity in that working environment to socially distance? Are there adequate hand hygiene facilities? Is there good environmental hygiene, surface cleaning, and again, is the area well ventilated? And if the work area meets all of those standards, it will be deemed as being COVID secure, and therefore in that area it will be appropriate for staff not to wear a face mask. But it is important to emphasise that if staff leave that COVID secure area to go to another part of the hospital, they must wear a face mask at that time.
So clearly when staff need to have the natural breaks, either to have the lunch or tea or coffee, then there might be a natural time for them to discard the mask. Obviously, hand hygiene first, remove the mask carefully by touching it from the ear loops only and disposing them into appropriate waste. Wash hands again, then they can have the food or drink. And then they should, once they're finished, again wash hands or alcohol gel and place a clean mask, which they can obtain either through the workspace or hopefully in the canteen. Clearly there may be other times that staff may need to have a short drink because they get thirsty and they cannot wait for the natural break. In those situations, what we would advise is that, again, they could clean their hands, touch the mask from the ear loops only. They can get the drink, have a little drink, and then again carefully place the mask back on. Clearly, if they touch the mask, ideally use some alcohol gel to clean their hands. Another important message for clinical staff is that when they transition from the clinical area to a non-clinical area, they need to remember to doff the mask that they were using on the ward and put on a new mask when they go out into the corridor. In terms of embedding that into your usual work, you have to remember what you always did when you were in that clinical area. Remember, you have a doffing station where you remove your mask that you would normally do as part of your previous experience of using PPE on the wards. The additional step now is just you need to place a new clean mask on as you transition into the corridor.